Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak to two infectious disease epidemiologists at Johns Hopkins about the concept of overdispersion, the idea that maybe 10 or 20% of people with COVID are responsible for a large share of the disease's spread. What's the evidence for overdispersion? And what does it mean for how we can respond? Joining me is Dr. Justin Lessler and Kira Grants, a doctoral student at the school. Let's listen. So Kira, thanks so much for joining me. And I want to start with a question. Can you explain overdispersion?
Sure. And thank you for having us to talk about this. So overdispersion is actually not something specific to infectious diseases. It's more of a statistical phenomenon, but it just means that you have a lot of variability in your population. And in infectious diseases, that normally manifests as this idea that a small proportion of people are responsible for a very large proportion of transmission. And so for COVID-19 or SARS-CoV-2, the virus, we think that about 10% of people are responsible for about 80% of transmission, which means that it's highly overdispersed.
So in other words, most people may give it to one person or no people, but then there's some, small set who might give it to 10, 20, 30, 50 people.
Exactly.
Is that the idea?
Exactly. Yeah. And so we often use the phrase super spreading event to talk about those high transmission events or people that occur.
So Justin, I'm going to turn to you. What is the evidence that transmission of the coronavirus is subject to overdispersion?
So we have a few threads of evidence. One is just we see super spreading events. Though I would be cautious about, overinterpreting that because it's a bit biased in observation. You're going to hear about it if a ton of people get infected, and, like a choir or some of these events. But if you got infected, when you went to Starbucks, nobody's going to be reporting that in, CBS News or something. But there are a couple other things. And what originally got Kira and I interested in this way back in, I think it was February, was the fact that it was taking a long time for the disease to show up in countries. Even though there was a big, vigorous outbreak going on in Hubei province, we weren't seeing the disease show up in other countries. And a lot of people were saying, why? Why is that we're not seeing transmission there? And, we were saying, well, it's because of this overdispersion phenomena is one possible explanation. Because if a lot of people aren't transmitting, and a few people are transmitting a lot, what happens is you have to wait longer for that person to transmit a lot to come along to really start your epidemic in your country. And when it does start, it starts fast, but it takes longer for it to show up. And I think that was an early piece of evidence. And I want to give one final piece of evidence because it also illustrates something that I want to be very clear about in overdispersion is household studies. Even when we go look at household studies or contact tracing studies like we did in Shenzhen, China, we find evidence of overdispersion. But there it's a highly controlled situation because everybody was being traced for contact. So the mean transmission rate isn't that high. So there we're contrasting zeros with threes, fours, and fives in terms of number of transmission. It doesn't have to be these 10s, 20s, 30s out there transmitting to be overdispersed. It can be lower numbers, but the phenomena can still be there.
Interesting. Is there biological evidence? In other words, do you see that some people barely emit virus and other people emit huge amounts of virus, or has the biological evidence not really been brought together yet with this epidemiological evidence?
So I think there is biological evidence for variation in how much people shed virus, but I really wouldn't focus on the biology so much when thinking about overdispersion. I would think about that intersection between biology in social contact or social interaction. So it could be, it's not quite true, but it could be that all of us shed a ton of virus, on our third day after infection. But most of us stay home and watch Netflix, whether or not we're feeling sick. But that one person who went out to the grocery store or went to, a choir practice or something like that, that person, because they did it at that right moment, could cause tons and tons of transmission. Whereas all of the other people who stayed home would not. And human contact itself is overdispersed. So, therefore, transmission comes from human contact. It is also.
Got it. So I'm going to turn back to you, Kira. And what are the implications of this evidence and this theory? What does this mean for how we can fight the coronavirus?
Yeah, I think Justin already touched on a key implication, which is that when you're looking at introductions of the virus into a new place, you might not see transmission immediately. So for places that can have really strong border control, you might not see many introductions, but even at just a single introduction getting through can very quickly spark a large outbreak if that happens to be sort of unfortunate super spreading event. And then when you're dealing with a place that has more established transmission, you can think about it in terms of how you design your interventions, which is that most people aren't going to transmit a lot. So you don't necessarily need to target most people for your transmission. If you're able to identify the context or the people that are most liable for these super spreading events, then you might be able to have more targeted control. And we've seen this, for example, in Japan. They've invested a lot in what they call their backwards tracing or their cluster investigation, where when they identify a new case, they kind of go back in time to try to find out where that individual was infected, because that gives them a higher probability of finding these super spreading events that they can then shut down. And it also gives them evidence for just broadly where these events are occurring and where they might put in restrictions or recommendations, for example, that people not visit crowded indoor locations. The problem is that targeting is very difficult, and we don't always know where these events occur. And again, if you miss even just one or two of these big super spreading events, you're going to very quickly lose control of an outbreak.
So does this imply that it does make sense to have regulatory policies that limit certain kinds of gatherings, for example, because they're just so likely to be in that 10% of transmission?
I think so. Yeah, as Justin said, a lot of overdispersion is the overdispersion in social contacts. And if we can limit the number of times that an infected person comes in contact with 10 or 20 or 50 people, they won't be able to infect 10 or 20 or 50 people.
So, Justin, is this the sort of epidemiological explanation for why it's not a good idea to have a wedding with 400 people or indoors, or, people are thinking about limiting access to bars and other locations like that?
Yeah, I think it is in a lot of ways. I think we don't need a fancy term to know that, getting a ton of people together is going to, give the opportunity for virus to spread easily. And we recently published something talking about this sort of idea of hierarchies of risk in transmission. The greatest risk of transmission, despite all this debate about aerosol or droplet or whatever, we know the greatest risk is in households, these like long-term, close, intimate contacts. But if the virus only transmitted in households, it would die out because it needs to get between those households. And those big events they're really good at connecting up a lot of households and connecting up a lot of places and allowing the virus to jump between these places where it transmits most efficiently and allow it to keep surviving.
So do you think that if we were able to cut off, a big chunk of those 10% spreading events, the amount of transmission that goes from not just 1 to 1 person, but 1 to 10, 1 to 20, if we could cut those out, it would make it harder for the virus to spread within a population? How much harder do you think it would make it?
I think it would make it a lot harder. It would be disproportionately efficient, I guess, is what I'm saying. Any limitation in contact is helpful, right? I think I've said this before in the podcast that, the way we tackle this thing is chipping away here and there, right? It's not one big dramatic thing. And I don't want to say like limiting big crowd gatherings is like this one dramatic gesture. But I do think it may have a bigger impact than simply the percentage of transmission that happens in those events. For this reason that, you need these big super spreading events to keep the virus, reseeding it in the places that it transmits really efficiently.
Got it. Kira, any final thoughts about the implications of overdispersion?
No, but I think exactly as Justin was saying, like it's not at all shocking that shutting down these kind of larger events and larger social gatherings would have a lot of impact. I think the idea of overdispersion is just to say that they might have a larger impact than they would for a disease that is not transmitted in an overdispersed fashion. So I think the idea of overdispersion for coronavirus is very interesting, and I think it gets a lot of attention because people are naturally really interested in super spreading. It doesn't fundamentally really shift how we think about the virus. I think it gives us some new ideas for thinking about targeted control, but a lot of what we've already known about controlling diseases still applies.
Great. Well, thanks to you both for joining me today.
Thanks for having us.
Thanks for having us, Josh.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.